Bismillahirrahmanirrahim. There's a question: what is the difference between working diagnosis, primary diagnosis, provisional diagnosis, and definite or definitive diagnosis? So let's talk about the working diagnosis and provisional diagnosis. So yeah, that is the same thing. When you have assessed the patient, you have to treat the patient and you have to make a formulation, you have to make an impression that what to treat. Are you treating depression? Are you treating psychosis? Are you treating both? Are you treating obsessive compulsive disorder? Are you treating a mood disorder or a bipolar affective disorder? So that is your working diagnosis. That is your provisional diagnosis. Then you assess the patient in a series over some time, either in your outpatients department or in your ward. You carry out some physical, psychological, and social investigations. You take collateral history. You observe patients' interaction with other people, with the nursing staff, and with everyone. And then you come to a final diagnosis. So that is the final diagnosis. Now, usually working diagnosis is your primary diagnosis. And then you come to the secondary diagnosis as well. And similarly, final diagnosis should be your primary diagnosis. So primary diagnosis is two things. One is the diagnosis which came first. That is the thing. And then the secondary diagnosis is the diagnosis that comes afterwards, that is superimposed on something else or replaces something else. So that is the secondary diagnosis. And sometimes we can say that at this time, our working diagnosis is the primary diagnosis. So, for example, if we are treating schizophrenia, that means that schizophrenia is our working diagnosis. And maybe that's our primary diagnosis as well. So primary diagnosis, usually diagnosis which comes first, and the diagnosis which comes afterwards is something like the secondary diagnosis. So let's say a diagnosis, for example, a schizoaffective disorder. So patient had schizophrenia episode without any affective component in 1993. Let's say at that time, schizophrenia is the primary diagnosis. In the year 2002, he had another relapse of schizophrenia, and there were affective symptoms to the diagnostic extent, manic symptoms, to the diagnostic extent. Then in the same episode, and you were very sure that these symptoms were in the same episode. So that becomes the secondary diagnosis, that's schizophrenia, like it will be schizoaffective disorder. Or if we say schizophrenia is the primary diagnosis, 1993. In 1997, patient had a manic episode without psychotic symptoms, with no psychotic symptoms at all. And in 2002, he had a schizophrenic episode, psychotic episode. And there were no affective symptoms. So in that case, schizophrenia stays as the primary diagnosis. But in 1997, when the patient had a manic episode, that becomes the secondary diagnosis. So primarily, he's suffering from schizophrenia. Secondarily, he also suffered from mania. And maybe if there are more than 2 episodes or equal to 2 episodes, then maybe bipolar affective disorder separate to schizophrenia. So that is the differentiation between the schizoaffective disorder and bipolar affective disorder. And in schizoaffective disorder, both diagnoses should be like present at the same time within the same episode. So that is the primary diagnosis. Similarly, if we say that like the patient is having borderline personality disorder, now that will not go away. Personality disorders are lifelong, and even if you treat them, they will not go away. They will stay there as such. So the primary diagnosis is emotionally unstable or borderline personality disorder, and the patient gets depressed, clinically depressed for 3 to 4 weeks or so. And then you say secondary diagnosis is something like depressive disorder. So then you have to discuss all the comorbidities. So you'll say primary diagnosis is the emotionally unstable personality disorder. Secondary diagnosis is recurrent depressive disorder, current episode moderate. Now, in this case, for example, the patient is very depressed. You know that they have a history of borderline personality, but now you are treating their depression. So at this moment, you are treating depression. So that is the working diagnosis. So the working diagnosis is whatever disorder you are currently working on. That is the working disorder. The diagnosis you are treating now is the working diagnosis. So that's the difference between working diagnosis, primary diagnosis, provisional diagnosis, and definitive or final diagnosis. Now, if you are sure about both diagnoses, that the patient has emotionally unstable personality disorder and recurrent depressive disorder, both, in that case, you will say that these both are final diagnoses. So final diagnosis is something you are sure, and you only become sure after a series of assessments or after a couple of months of assessment. So first of all, you give the working or the provisional diagnosis. Now, working diagnosis may be your primary diagnosis, may be your secondary diagnosis. Working diagnosis may be your like the primary or secondary diagnosis, or it may be your provisional diagnosis, or it may be your final diagnosis. So whatever diagnosis you are working on currently is your working diagnosis. I hope it's clear. Thank you.